Hi, I'm Mallory, and I chose to do cocaine addiction for my signature assignment. Some brief history on cocaine. Cocaine is a very powerful stimulant drug that is derived from the leaves of the cacao plant, which is native to South America. Indigenous people in South America have used cacao leaves for thousands of years for medicinal, religious, and social purposes, specifically in the Amazonian rainforests and Andes mountain regions. And then in the early 19th century, European scientists first isolated cocaine hydrochloride from the South American cacao leaves. This purified cocaine became the main active ingredient in many tonics and elixirs that were developed to treat a wide variety of illnesses. Before the development of synthetic local anesthesia, surgeons would actually use cocaine as a pain blocker. This once glorified medical wonder drug is actually now recognized as one of the most addictive and harmful substances on earth. Cocaine is a legal, highly addictive central nervous system stimulant that can be snorted, smoked, or dissolved and injected into a vein. The CDC stated that in 2021, approximately 24,486 people died from an overdose that was involving cocaine. So some common forms of cocaine, the first being cocaine hydrochloride, which is the chemical form and is most commonly encountered on the streets or simply referred to as cocaine. It is a salt form and is the result of combining cocaine with hydrochloric acid. This process converts the alkaloid cocaine into a water-soluble crystalline form and is commonly then found as a fine white powder. It is often cut or mixed with other substances and sometimes mixed with other drugs such as fentanyl, which can end up being fatal. Cocaine hydrochloride can be ingested through various routes, including snorting, dissolving and injecting, or even ingesting and the rubbing on your gums. The method of administration influences the speed and the intensity of the drug's effects. The second most common form would be crack cocaine, which is a very potent and highly addictive form. Crack cocaine is typically processed into small solid crystals or rocks. These crystals that are broken into smaller pieces are known as crack rocks or simply crack. Crack cocaine is usually smoked by heating it in a glass pipe and then inhaling the vapors. This method allows the drug to reach one's brain very quickly, resulting in a rapid and intense euphoric effect. The picture on the bottom right is crack cocaine, and on the top right is going to be the cocaine hydrochloride. Cocaine's effects appear almost immediately after a single dose and then just disappear within a few minutes or an hour. The duration of the effects depend on the route of administration. So the faster the drug is absorbed, the more intense the resulting high, but it's a shorter duration then. So snorting cocaine produces a relatively slow onset, but your high may last for then 15 to 30 minutes or more, whereas the high you get from smoking is more immediate, but may only last 5 to 10 minutes. Some common street names are Snow, Blow, Coke, Crack. The psychological effect of cocaine use are significant and really contribute to the drug's appeal and potential for abuse. Some symptoms are as followed: euphoria effect, increased alertness, heightened sensory perception, increased confidence. Anxiety or paranoia, though, sometimes come with that, and irritability, agitation, and insomnia. It is important to note that while the initial effects may seem pleasurable, they are often then followed by a intense crash or a come down phase, which is categorized by feelings of depression or fatigue, and then a strong desire to use the drug again to avoid this come down feeling. It becomes a cycle. So repeated uses then can lead to the development of a tolerance or dependence and then addiction, which follows a range of negative effects and consequences for one's mental health and just overall well-being. So for physiological effects, there are a lot. Cocaine has a profound physiological effect on the body, and primarily due to its action on the central nervous system, since it is a central nervous system stimulant. It primarily acts by blocking the reuptake of neurotransmitters such as dopamine and serotonin in your brain. This leads to an accumulation of these neurotransmitters in the synapses, which then intensifies signaling between nerve cells. One of the immediate physiological effects of cocaine use is the stimulation of the cardiovascular system. Cocaine can cause a rapid increase of your heart rate and tachycardia and an elevated blood pressure and hypertension. These effects can contribute to an increased risk of heart-related complications, such as heart attacks and arrhythmias. Cocaine use often also results in dilated pupils. This is due to the drug's impact on one's autonomic nervous system, which controls your involuntary bodily functions, including your pupil size. Cocaine can lead to an increase in your body temperature and hyperthermia. This effect is a result of the drug stimulating properties and can contribute to additional and various health risks. Cocaine use can be associated with appetite suppression, and chronic use can lead to weight loss and malnutrition. This effect is partly due to the drug's impact on your neurotransmitters that are involved in appetite regulation. Cocaine has vasoconstrictive properties, causing a narrowing of blood vessels, and this effect can lead to reduced blood flow to various organs throughout your body and tissue, contributing to serious health risks such as cardiovascular complications. Cocaine is also associated with the increased risk of seizures and strokes. So the vasoconstrictive properties that I just mentioned can also lead to reduced blood flow to your brain, not just throughout your body. And this increases the likelihood of very serious complications, even death. So the pathophysiology of a cocaine addiction. Like I said earlier, it is a central nervous system stimuli. So in the normal neural communication process, dopamine is released by a neuron into the synapses, where it can then bind to a dopamine receptor on a neighboring neuron. Normally, it is then recycled back into the transmitting neuron by a specialized protein called the dopamine transporter. However, when cocaine is present, it attaches to the dopamine transporter and then blocks the normal recycling process, which results in a buildup of dopamine in the synapses, which then contribute to that pleasurable euphoric effect of cocaine. There's a diagram of all of this just at the bottom right. Rewiring the reward system within your brain begins to then change from cocaine. It begins to change with your repeated exposure and use of the drug, and it makes the reward system less responsive to natural reinforcers and makes a user more likely to focus on solely seeking the drug instead of seeking relationships, food, or other, natural rewards. With repeated users, individuals may develop a tolerance to the effects of cocaine, which then leads to requiring a larger dose to achieve that same euphoric effects. And it begins to cause people to chase that euphoric high and take in more larger and larger doses of cocaine. This is also how a lot of overdoses happen. Let's say you get sober for a period of time, and if one were to then relapse and maybe they thought they could take that same large dose that they were taking when they were regularly using, but they go to take it after they had been sober for a year or so, it can cause them to succumb to complications and die. The prefrontal cortex is the brain's region that's involved in decision-making, impulse control, and judgment. It's adversely affected by the chronic cocaine use, and this dysfunction contributes to the difficulty of individuals with addiction to face the urge in resisting drugs despite their awareness of all the negative consequences it comes with on their body, on their mental health. But it just affects the decision making and their impulse control. They're just chasing the euphoric effect and the high. Cocaine's effect on the brain's learning and memory processes associated with drug-related cues with the rewarding effects of cocaine. This association then just reinforces drug-seeking behavior and contributes to relapses and chronic cocaine use. Many individuals with cocaine addiction usually have co-occurring mental health disorders, such as depression or anxiety, which can exacerbate the risk of relapses, as many may use drugs, usually to self-medicate those mental health disorders. So the American Addiction Center stated that approximately 24% of people relapse back to weekly cocaine use following just a year of sobriety. Now, treatment for cocaine addiction typically involves a combination of behavioral therapies, counseling, support groups, and in some cases, medications. Although it is important to note, there's currently no FDA-approved medication specifically designed for treating cocaine addiction. So the focus is often on the behavioral interventions and support groups, counselings. But research is currently testing medications that act as a dopamine receptor, a dopamine D3 receptor, which is a subtype of dopamine receptor that is abundant in the emotion and that reward center in your brain. Research is also looking at medications that act as serotonin receptors. Currently, over 5 million Americans reported cocaine use in 2020, which is almost 2% of the population. Some demographics for cocaine addiction, cocaine use. Actually, researchers show that drug overdose deaths involving stimulants like cocaine have increased significantly and are disproportionately affecting racial and ethnic minority populations. So non-Hispanic Black people experience the highest death rates for overdosing involving cocaine in 2019. Typically, cocaine addiction targets a younger demographic than older. However, cocaine addiction can and does affect individuals across various demographic groups. In 2018, the rate of drug overdose deaths involving cocaine was highest in urban counties in the Northeast and lowest in rural counties in the West. I did find one AI involvement study in Ohio that has research that the FDA-approved anesthetic ketamine is promising to treat cocaine addiction. In this study, a possible drug list was screened using an AI-based drug discovery algorithm. Following this screening and an evaluation by a panel of specialists in addiction chaired by the researchers, it appeared to be a promising choice. However, prior to this research, it was indicated that ketamine is effective for treatment in cocaine addiction. However, there was just not enough diversity or enough patients to be conclusive. So then employing their screening method and with the help of AI, the researchers were able to attain a greater diversity of participants by race, gender, and medical and psychiatric conditions. Then after examining the tens of millions of electronic medical records, the researchers assessed the possible therapeutic efficacy of ketamine in raising remission rates among patients with cocaine use disorders. They discovered that this actually led to 2 to 4 times better remission rates for patients with cocaine use disorders who were given ketamine for the pain or depression to help with their sobriety. Here's my reference page. Thank you.